Are you curious about the uses and benefits of bupropion? In this video, we will delve into the various applications, benefits, potential adverse reactions, dosage recommendations, and hazards associated with this medication. Bupropion, commonly known by its brand name Wellbutrin, is a medication primarily used to treat depression and aid in smoking cessation. It belongs to the class of drugs called antidepressants and works by balancing certain chemicals in the brain that affect mood. Bupropion has gained popularity due to its effectiveness in improving depressive symptoms and helping individuals overcome nicotine addiction. It may also be prescribed off-label for other conditions such as attention deficit hyperactivity disorder, ADHD, and seasonal affective disorder, SAD. Like any medication, bupropion does come with potential adverse reactions and hazards that need to be considered. Whether you are a healthcare professional looking to learn more about bupropion or an individual seeking information about this medication, this comprehensive guide will provide you with all the essential details to make informed decisions. So, let's dive into the world of bupropion and explore its uses, benefits, and potential risks together. Common uses of bupropion. Bupropion is primarily prescribed as an antidepressant, specifically for the treatment of major depressive disorder, MDD. It is effective in improving depressive symptoms by increasing the levels of dopamine and norepinephrine in the brain. These neurotransmitters play a crucial role in regulating mood and emotions. Unlike other antidepressants, bupropion does not typically cause sexual dysfunction as a side effect, making it a preferred choice for individuals who may be sensitive to these effects. In addition to its use in treating depression, bupropion is also commonly prescribed for smoking cessation. It helps individuals quit smoking by reducing nicotine cravings and withdrawal symptoms. Bupropion works by blocking the reuptake of dopamine and norepinephrine, creating an effect similar to that of nicotine in the brain, thus reducing the urge to smoke. It is often used in combination with counseling or behavioral therapies to maximize the chances of successfully quitting smoking. Another potential off-label use of bupropion is in the treatment of attention deficit hyperactivity disorder, ADHD. While it is not a first-line treatment for ADHD, some studies have shown that bupropion may be beneficial in reducing symptoms of inattention, hyperactivity, and impulsivity in both children and adults. However, more research is needed to establish its efficacy and safety in this particular use. In the case of seasonal affective disorder, SAD, bupropion has been found to be effective in reducing symptoms associated with this seasonal depression. SAD is characterized by the onset of depressive symptoms during specific seasons, usually during the winter months when there is less natural sunlight. Bupropion's mechanism of action, which involves increasing dopamine and norepinephrine levels, helps alleviate the symptoms of SAD and improves overall mood. In summary, bupropion is commonly used for the treatment of major depressive disorder, smoking cessation, and may have potential off-label uses in the treatment of ADHD and seasonal affective disorder. Its effectiveness in improving depressive symptoms and aiding in smoking cessation has made it a popular choice among healthcare professionals. Benefits of using bupropion. One of the main benefits of using bupropion for the treatment of depression is its relatively low incidence of sexual side effects compared to other antidepressants. Sexual dysfunction is a common side effect of many antidepressant medications, causing significant distress for individuals. Bupropion, however, does not typically cause these adverse effects, making it an attractive option for individuals who may be concerned about the impact of antidepressant therapy on their sexual function. Additionally, bupropion has been found to have a relatively rapid onset of action compared to other antidepressants. Some individuals may begin to experience improvements in their depressive symptoms within the first few weeks of treatment. This can be particularly beneficial for individuals who are experiencing significant distress or impairments in functioning and require prompt relief. Another benefit of using bupropion is its potential for aiding in smoking cessation. Quitting smoking can be a challenging process, and nicotine cravings can be intense. Bupropion helps reduce these cravings and withdrawal symptoms, increasing the chances of successful smoking cessation. It is often used in combination with counseling or behavioral therapies to address the psychological aspects of nicotine addiction. Furthermore, bupropion has been found to be effective in reducing symptoms associated with seasonal affective disorder, SAD. SAD can significantly impact an individual's quality of life during specific seasons, and bupropion's ability to improve mood and reduce symptoms can greatly alleviate the distress experienced by those affected by this condition. By increasing dopamine and norepinephrine levels, bupropion helps regulate mood and provides relief from the depressive symptoms associated with SAD. Overall, the benefits of using bupropion include its low incidence of sexual side effects, relatively rapid onset of action, effectiveness in aiding smoking cessation, and potential for alleviating symptoms of seasonal affective disorder. These benefits make it a valuable medication for healthcare professionals and individuals seeking relief from depression and nicotine addiction. Potential adverse reactions and side effects of bupropion. While bupropion is generally well tolerated, like any medication, it can cause potential adverse reactions and side effects that should be considered. It is important to note that not everyone will experience these side effects, and they may vary in severity from person to person. It is crucial to discuss any concerns or potential side effects with a healthcare professional before starting bupropion. Common side effects of bupropion include nausea, dry mouth, headache, dizziness, and insomnia. These side effects are usually mild and transient, resolving on their own as the body adjusts to the medication. If these side effects persist or become bothersome, it is recommended to consult a healthcare professional for further guidance. In rare cases, bupropion can cause more serious adverse reactions such as seizures. The risk of seizures is dose-dependent and increases significantly at higher doses. Individuals with a history of seizures or certain medical conditions that increase the risk of seizures should use bupropion with caution. It is important to follow the prescribed dosage and inform the healthcare professional about any pre-existing medical conditions or medications to minimize the risk of seizures. Another potential adverse reaction associated with bupropion is the possibility of increased suicidal thoughts or behavior, particularly in children, adolescents, and young adults. It is crucial to closely monitor individuals taking bupropion for any changes in mood, behavior, or suicidal ideation. Promptly reporting any concerning symptoms to a healthcare professional is essential in ensuring appropriate intervention and support. Other less common side effects of bupropion include agitation, anxiety, irritability, tremors, and changes in appetite or weight. These side effects should be monitored, and if they become severe or persistent, it is advisable to seek medical attention. It is important to remember that the benefits of using bupropion generally outweigh the potential risks. However, it is crucial to be aware of the potential adverse reactions and side effects associated with this medication and communicate any concerns to a healthcare professional for appropriate guidance and support. Dosage recommendations for bupropion. The dosage of bupropion prescribed may vary depending on the specific condition being treated and individual factors such as age, weight, and overall health. It is essential to follow the prescribed dosage instructions provided by the healthcare professional and not exceed the recommended dose without medical guidance. For the treatment of major depressive disorder, the initial recommended dosage of bupropion is usually 150 mg per day, taken orally. The dosage may be gradually increased to a maximum of 300 mg per day, depending on the individual's response to the medication. It is important to note that higher doses may increase the risk of seizures, and caution should be exercised when titrating the dosage. When used for smoking cessation, bupropion is typically initiated at a dose of 150 mg per day for the first 3 days, followed by an increase to 150 mg twice daily. The treatment duration for smoking cessation with bupropion is usually 7 to 12 weeks, depending on individual needs. It is important to start bupropion at least 1 week before the planned quit date to allow the medication to reach its full effectiveness. For off-label uses such as ADHD and seasonal affective disorder, the dosage of bupropion may vary. It is important to consult with a healthcare professional to determine the appropriate dosage based on the specific condition being treated and individual factors. Dosage adjustments may be necessary for individuals with liver or kidney impairment, as bupropion is primarily metabolized by these organs. Close monitoring and appropriate dosage modifications are essential in these cases to ensure the safe and effective use of bupropion. It is crucial to strictly adhere to the prescribed dosage instructions and consult with a healthcare professional for any concerns or questions regarding bupropion dosage. Abruptly stopping bupropion without medical guidance can lead to withdrawal symptoms and should be avoided. Precautions and hazards associated with bupropion use. While bupropion can be an effective medication for the treatment of depression and smoking cessation, there are certain precautions and hazards that need to be considered. It is important to discuss these with a healthcare professional before starting bupropion to ensure its safe and appropriate use. Individuals with a history of seizures, eating disorders, bipolar disorder, or those taking medications that lower the seizure threshold should exercise caution when using bupropion. The risk of seizures is dose-dependent, and close monitoring is necessary to minimize this risk. Bupropion can interact with other medications, including monoamine oxidase inhibitors, MAOIs, and may cause serious adverse reactions. It is important to inform the healthcare professional about all medications, including over-the-counter medications, supplements, and herbal remedies, to avoid potential drug interactions. Pregnant or breastfeeding individuals should consult with a healthcare professional before using bupropion, as its safety during pregnancy and lactation has not been fully established. The potential risks and benefits need to be carefully considered in these cases. Additionally, bupropion may increase the risk of suicidal thoughts or behavior, particularly in children, adolescents, and young adults. Close monitoring and regular follow-up with a healthcare professional are essential during the initial stages of treatment and dosage adjustments. It is important to be aware of the potential hazards associated with bupropion use and communicate any concerns or pre-existing medical conditions to a healthcare professional. This allows for appropriate assessment, monitoring, and guidance to ensure safe and effective use of the medication. Comparing bupropion with other antidepressant medications. When considering the use of bupropion for the treatment of depression, it is important to compare it with other antidepressant medications to determine the most appropriate choice for an individual. Each antidepressant medication has its own unique properties, benefits, and potential side effects. Selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed as first-line treatment for depression. They work by increasing the levels of serotonin in the brain. SSRIs, such as fluoxetine and sertraline, are generally well tolerated and have a lower risk of serious adverse reactions compared to older antidepressant medications. However, they may cause sexual side effects and can take several weeks to show significant improvement in depressive symptoms. Serotonin norepinephrine reuptake inhibitors, SNRIs, are another class of antidepressant medications that increase the levels of both serotonin and norepinephrine in the brain. Examples of SNRIs include venlafaxine and duloxetine. SNRIs may be particularly beneficial for individuals who experience both depressive symptoms and physical pain, as they can help alleviate both conditions. However, they may also cause side effects such as nausea, dizziness, and increased blood pressure. Tricyclic antidepressants, TCAs, are older antidepressant medications that are less commonly prescribed due to their potential for more severe side effects. TCAs work by increasing the levels of serotonin and norepinephrine in the brain. They may be effective in treating depression, but their use is often limited to cases where other antidepressants have been ineffective. TCAs have a higher risk of side effects such as sedation, dry mouth, constipation, and cardiac effects. When comparing bupropion with other antidepressant medications, it is important to consider individual factors such as medical history, medication tolerability, potential side effects, and treatment goals. A healthcare professional can provide guidance and make an informed decision based on these factors. Bupropion for smoking cessation. One of the notable uses of bupropion is in smoking cessation. Nicotine addiction can be a challenging habit to break, and bupropion has shown efficacy in reducing cravings and withdrawal symptoms associated with quitting smoking. Bupropion works by blocking the reuptake of dopamine and norepinephrine, creating an effect similar to that of nicotine in the brain. This reduces the urge to smoke and helps individuals overcome the physical and psychological dependence on nicotine. It is important to note that bupropion does not contain nicotine and is not a replacement for cigarettes or other nicotine products. When using bupropion for smoking cessation, it is typically initiated at a dose of 150 mg per day for the first 3 days, followed by an increase to 150 mg twice daily. The treatment duration is usually 7 to 12 weeks, depending on individual needs. It is recommended to start bupropion at least 1 week before the planned quit date to allow the medication to reach its full effectiveness. Quitting smoking is a complex process that often requires additional support and behavioral changes. Bupropion is often used in combination with counseling or behavioral therapies to address the psychological aspects of nicotine addiction. This comprehensive approach increases the chances of successful smoking cessation and long-term abstinence. It is important to consult with a healthcare professional before starting bupropion for smoking cessation to discuss the potential benefits, risks, and appropriate treatment duration. A personalized plan, tailored to individual needs, can maximize the chances of successfully quitting smoking and improving overall health.